Hello, my name's Dr Sean Pert and I'm a speech and language therapist and a senior lecturer at the University of Manchester. In partnership with LGBT Foundation, I provide advice and therapy to people who'd like to change their voice and communication. You'll notice that I don't mention whether people want to be one particular gender or another, because we're very happy for people to be non-binary or choose exactly how they'd like to present. During this course of videos, I'd like to show you some techniques which will help you safely change your voice and communication. These involve 6 different aspects. The first and the most important is breathing. Breath is the support for your vocal folds. They what make the buzzing sound that is your voice in your voice box, and good breath support will mean that you will be able to power your voice for all the exercises. There's also pitch change. This is how high or how low your voice is. This is something that people often focus on quite a lot, and although it's important, it's not the main thing that you should focus on if you're thinking about changing your voice and communication. You should think about changing all the different aspects, particularly including things like resonance, which gives pitch change more authenticity. We also think about things like articulation, body language, and volume, because people who change their pitch might find that they're not able to keep the volume going when they do that. This all again is related to how you support your voice with breathing. Above all, changing your voice should be a slow, steady progress over a series of months, not an overnight change. You may be aware of other techniques that you may have come across online which may put your voice at risk. Without good breath support, using muscles in your neck, around your voice box, straining the voice can cause long-term damage. So please look after your voice and consult a speech and language therapist if you need additional support and advice. If you've ever had difficulty with your voice, so for example losing your voice, or ever had an operation that's affected your vocal folds, then please contact your GP and ask for a referral to ear, nose and throat, ENT, before trying any of these exercises. One of the main things about voice and communication change is that it should make your voice and communication more aligned with who you are as a person. Voice is very personal, it's how we express our identity, and it can play a great part in reducing feelings of dysphoria or discomfort. However, you must build up to this and also be aware that listeners who are familiar with your current voice and communication might be quite surprised at the changes you make. So if there are people that you regularly interact with, do talk to them about the changes you'd like to make and get their support. It's a really good idea to make recordings, either audio recordings or video recordings, even if you don't plan to look at them. It's quite useful when you're several months in to review your progress, and you might be surprised at the changes you've been able to make. Don't be disappointed if you aren't able to do these exercises immediately. These are things that I've been practicing as a practicing speech and language therapist for many years. I would expect it to take several months for people to master the techniques. So do be patient with yourself and forgive yourself if you make some mistakes, and just have another go. If at any point during your exercise regime you find that your voice feels sticky or dry, or that you are clearing your voice a great deal, that's a sign that your vocal folds are irritated. Make sure that you keep well hydrated, and please have voice rest. At no point force your voice or push your voice further. If you've had a very busy day, or if you are a professional voice user, say you work in a call centre or you're a teacher or a singer, then be aware that you're putting a great deal of demand on your voice on a daily basis, and do build in voice rest into your routine.